Hey everyone, thanks for joining us today. Today I've got Dr. Eric Serrano here with us. I'm going to ask Dr. Serrano several questions that once answered, hopefully help all of you out there feel a little bit safer and more empowered with the choices you could be making to help you stay, safe and healthy from what's going on out there. And I think he's even going to tell us how a few of his patients that have tested positive have recovered from it, what's helping them recover, and what kind of things he's been seeing in his office lately. So, Dr. Serrano, obviously we got this, COVID-19 going around. Whether it's this one thing or this, whether it's really as bad as people say it is, or it's not, that's not what I'm really trying to get at. Wanted to bring you in today because, obviously as a medical doctor, you're getting exposed to people who have it. You're connected with other doctors around the world who are seeing it. So you are obviously this bed of information that I think we could pull some helpful things out of. So what are you seeing in terms of severity, and are certain kinds of people more susceptible to it? Are there, is it like a weak respiratory system, a weak overall immune system? Like, what are you seeing?
Okay, first of all, what we're discussing here is not medical advice. It's only
right.
Talking about it. So I want to tell people out there. Hold on, my dog is barking. Hold on.
Dr. Serrano has lots of animals.
I want to make sure that this is no medical advice, it's just information. But we just recently gave a talk about this with a bunch of doctors. The first thing is, of course, wash your hands, clean them with alcohol. And it's kind of funny because sometimes we forget how to clean. But if I'm going to be with people, I'm with people. As soon as I'm with those people, wash your hands or take alcohol swipes. Clean the wheel drive, and then you don't have to worry about taking it home. Number one. Number two is, I want to tell people that the people getting it are people that are either have a disease, are older. Okay, children rarely get them, although there have been cases in the United States of death of children. Pregnant women might get it, but doesn't hurt them at all. You guys have not seen a case, and I think it's secondary to melatonin, and I'm going to explain in a second. First of all, I'm going to try to give you all information that is scientifically proven. I don't want to give you information anecdotal because then I'll be lying to you guys. Although I want to discuss things anecdotal because I've seen it in the office and I dealt with it. In my office, we have I have 3 doctors in my office. There is about 9 doctors on the other side. The other doctors are not seeing patients. What they're doing audio on internet, and they step out, they walk outside to the patient's car, they're giving them medications or whatever they're doing. I'm not doing that. I'm still seeing patients every day. We have seen 3 cases. We tested about 9 people. We have turned around about 17 people that called that almost sure they have it because they have contact history. They were doing fine. They were not that sick, but we said, stay home because we test you, you have to go quarantine. The people that we know got it, they lasted about 2.5 weeks. So they were kind of sick, coughing. They were all females, by the way. One of them was a bodybuilder that came out of the country, and she was dieting and things like that. The second one was a mom. She was on her 50s, and the other lady was on the 30s, and the third person was on their 40s, but doing well. She traveled to Egypt and China and things like that. All of them are doing well. We treated them. Now, how do we treat them? We use Zitromax and chloroquine or the malaria medicine, like they're saying on the news. It does work. I add zinc to it. I add 50 milligrams because the research shows that zinc actually helps with the infection. Now, I want to talk a little bit about the coronavirus. The key about the coronavirus is that the flu virus infects one person. So it's like a 1-to-1 ratio, basically. The coronavirus, how you are infected and you can infect 3 people at the same time. That's how powerful it is. So the infection rate is higher, but the death rate is less. Okay, so I want people to understand that. Now, I said before that if you're pregnant, you're pretty much safe. I don't want people to go out and get knocked up here. But the reason the pregnant women are better is because they release something called melanocorticotropin releasing hormone, which is a melatonin-like hormone. Melatonin has shown actually research helps against the viral infections. This is not anecdotal. This is on the literature. Also, the virus has something called LPA2, which is a lipid in the virus that it releases, and it's actually used as a marker also for the infection. And they do CDP polling have shown to block this urine test, meaning blocks that pest, but it doesn't mean that it cures or treats it, but it might actually make a difference. We do not know yet. He has shown on the literature, and actually the government of the United States is doing a trial right now using 1 gram or 3 grams, which are not that high dosages, but they're working on it. If I was a person that had contact with somebody that is sick, I would start taking vitamin A, vitamin D, and vitamin C at high dosages. Now, again, this is no medical advice, it's just conversing, and the vitamin A has to be about at least 100,000 IUs every day for 14 days. The vitamin D is 50,000 IUs every day for 10 to 14 days, and the vitamin C, 6 grams every single day for that during that period. If you have low levels of zinc, or you eat low meat, or you eat low nuts, then you want to have 50 milligrams of zinc added to that. Now, melatonin is also added at night because not to help you sleep, because also with protection. The minimum dose for melatonin is about 3 to 6 milligrams, depending on the person. I want to say this, the dosage that I just gave you are for almost treatment if you feel like you're going to get it. But it actually prevents, vitamin A actually helps your immune system. Vitamin D has shown to actually help in the coronavirus, and there's a couple of papers on that. And vitamin C was a treatment at China. Now, there's a couple of, I would say, websites out there, and I don't have them in front of me right now, but I will look it up in a second. It will show how to treat it also. Now, be aware that if you do have diabetes, you have an autoimmune disease, or you are treated by chemotherapy, you have cancer, you're a risk factor. Be aware that you're vapor or vaporing, meaning you smoke or you don't smoke, okay, because you want to look cool. Vaporing causes a disease called popcorn disease. And popcorn disease is what is kind of fibrosis. Your x-ray looks like a popcorn. That's what it came from. And actually, it causes fibrosis of the lung. And the way that COVID virus kills you is actually through fibrosis. So if you are a vaporing type of person, and usually most of the people are teenagers now, you're going to have issues with this virus. And I want to say this, even quote unquote, if you're healthy. Now, most people think they're healthy because there's absence of disease. Absence of disease doesn't mean you're healthy, because
Right.
you have no disease, but you can have selenium deficiency, you can have vitamin C deficiency, you can have zinc deficiency, which puts you at a health negative step. Not that you have a disease, you will eventually catch a disease, but I want to say absence of disease doesn't mean you're healthy. I want to make sure that you guys understand that. Now, to be out there, to have contact with people, of course, we need to follow the rules. I would say stay away from groups of people. Make sure that you buy food, no toilet paper. And it's funny because you go to the store and they say the food is gone. And I go to a store again, and all the good food is there. The vegetables, the fruits, they're packed. But then you walk by the cereal bread aisle and there's none.
Yeah.
All gone. It's funny. People are just buying junk shit, not buying real food, which will make the disease worse, actually.
Right.
I had a patient that had one of my diabetic patient came with DKA, and she was actually helping me at the office during this time. And she thought she had the coronavirus. She didn't. She just developed DKA, and she was really sick, and she thought she had it, but she didn't. I do want to tell people there that there have been 4 or 5 cases in which started with diarrhea, and I know they have not shown that, and I don't want to scare people, but diarrhea, sometimes the virus can start like that. Is it because your immune system is not up to par and then it can affect that? Yes, it can. But I just want to tell you there have been a few cases documented that way. And again, I hope that if you guys are out there, I'll make sure that I supplement with vitamin A. I do not mean beta carotene, because beta carotene depletes zinc. So let me explain that for people out there. I know that vegetarians out there that, oh, I'm taking vitamin A because I consume beta carotene. Beta carotene is not vitamin A. Vitamin A is retinoic palmitoic acid. And you need vitamin A, not beta carotene. Now, to convert beta carotene to vitamin A, you require zinc. So now you have a virus, and I have beta carotene. I'm eating my vegetables. I'm taking beta carotene. Now the body says, hey, we're sick, we need to convert to vitamin A. Now you're going to deplete your zinc levels because actually you're trying to convert that beta carotene into something you actually need. So you need to get good vitamin A, fat soluble vitamin A, not beta carotene. Let me repeat that. And also make sure that you take vitamin D3, which is the active form, and take the dosage that I told you. The only time that I do not advise for you to take these dosages is if you have a history of calcium oxalate formation or you have a G6DP enzyme deficiency, but that is very rare. In 30 years, I've never seen it. So just be aware of that. And I hope that helped the listeners to understand what's going on and understand that a little better.
Yeah, no, I think that's very helpful. I think you hit all the bases I wanted to cover in one question. So, is there anything else you want to give people out there?
Yes, I want to tell people out here that the test that we're using right now. Okay, there was a paper that came out that looked at it. And by the way, the true people are not going to believe me, but you can look it up in the internet. If I had a test to really tell me if you have coronavirus disease, it's a CT scan of your chest. It's not a PCTR. It's not no nasal. CT scan is actually 100% accurate. There was a research paper that came out, Jans, and the reason they retracted the paper was because they didn't want to scare the people. And it's that this test that we're using right now have about 87% of false positive, meaning that you're going to have a bunch of people that test positive, but in reality, they do not have the virus.
Right.
So that question, is it the virus as common as we think it is, based on this blood test or this saliva or this nasal test? And I want to be aware that many people that are getting tested, they might be positive, but they're not truly positive. So which can make the numbers skew to either, oh, maybe we don't have that many people infected, but they're dying with the virus, or, we really have that many people infected. I don't have the answer for that one.
Yeah. So, yeah, keep it. Yeah. I think it's smart for everybody to just take the numbers that we're getting with a grain of salt. Nobody knows exactly really what's going on in the big picture. But I think the general consensus is that it's not as as deathly of a disease as they originally made it out to be. But people still need to be smart, follow the rules, do their part, right?
You know what, Chaz? Somebody, a lot of people don't know this, but I want you to teach. If we take January and February, okay, only the first 2 months of 2020, only 2 months, there was 2,022 deaths due to the coronavirus, right? But there was 153,000 suicides the first 2 months of 2020. And people are going to go, what does that have to do with it? Well, Chance, I'm going to close your business right now. You're closed, correct? So yes. your income is affected, right? Yes. Now I have a house and I cannot make payments. I have this business that I opened. Now I don't have no business. I have no way to pay my bills. I don't have way to get out of this. What do you think the number of suicides is going to go up or not? Absolutely. Yeah. So be aware of this, that these numbers that we're seeing, yes, the virus is affecting us, but there's people out there that they just spend money on a house. They just bought a new business. They started a new company, and they bought all this money. And I know that the president is doing an amazing job trying to catch up. But just be aware that this sadness, this loneliness, this separation might affect us. And I know that you have children, Jans. This separation has been awesome. My kids are all home, except the one that is in the military, and my second daughter, she's essential because she works for the drug company. That's in charge of producing IV medication, so she cannot come. But all my other daughters are home. It's kind of fun, because we're playing games, we're spending time together, we're playing on the water outside. So we're doing things that we didn't do for a while and having a great time. We haven't watched TV at all. We're always playing, doing games. And my house has been full because the people come over and we talk. And I don't recommend that because you want to be in isolation. But Jans knows he's been here before, so he's always
There's no stopping it, yeah.
So it is pretty fun. But I just want to be aware, this is a time for you to take it and spend time with your family. Get to know your kids if they've been gone. Get to know your wife. I see a lot of jokes. They send me, Eric, are you still married now? You cannot get out of the house, But it is fun. And take time to do it. Now, I heard rumors, and this is a rumor, that they might disconnect the internet for 2 days, which it will be amazing because I won't get bugged. And, it will be so cool for me. I'm looking forward, if they really do that, it would be amazing. but I don't know if they'll do it. But think of all the people that are going to be. This is the time that we have the most contact with people with the most loneliness. And it's kind of funny because we get into the internet and I'm okay now because I can see and you're working out through the internet, you do all this stuff, but it is insane what people are going to go through that is related to the coronavirus, but it's not the coronavirus. You know, I lost my business. I don't have any money. I have children. Who knows how many people are going to end up dying, you know? So I have to look at all those things. As a physician, I saw gym owners this week, and both of them came. They were sad. They were crying. Said, Eric, I'm going to lose my business. You know, we live check to check, you know, because they're being 2 years open and they're concerned. And so, you know, hopefully with what Trump is doing is, you know, he's going to get you the money or get you the loan or whatever that you'll be able to survive. We'll see what happens. The numbers are skewed. Now, the only town or the only place that is pretty scary is Italy. And I want to tell this to people. There's a lot of people die on Italy that is actually a lot of people compared to the percent. But I want to tell people something that they don't know about Italy. In Italy last year, they passed a law that everybody has to be vaccinated. And they created a new flu vaccine. It was a special new flu vaccine that it was active against 3 flu. And this vaccine was injected to everybody that, you know, supposedly by law, everyone was supposed to get it. Of course, I'm sure there was people that didn't get it. But this vaccine can, by this injection, you can actually modify your immune system to not react against coronavirus. And I think that's what really happened. And that's a hypothesis. That's not documented, but I'm seeing more and more on the internet that the people dying in Italy is because they were vaccinated with this vaccine. So be aware of that. Don't go crazy and say, I'm going to get vaccinated immediately. Not that I'm against vaccines, but be aware, I'm going to go get vaccinated, because the first thing is make sure that your body, your immune system can handle the virus. It doesn't matter through a vaccine. It doesn't matter through the real virus. Make sure that your nutrition is up to par. So when you go get that vaccine or whatever you're going to do, you're able to battle it and build an immune system. So,
yeah. Again, thanks. You shared so much with us today. We might, I might try to reach out to you again in the future if anything pops up that we want some good answers on. But hey, I know your time is extremely valuable, so I thank you for sitting down with me today.
Yes, I want to add one more thing. For people out there, there's a great book called Antiviral Protocol by a guy named Dr. Alex Vasquez, and I know you're on the group. He wrote a book that is amazing, and it's only $3. Just go to the website and buy it. Has tons of information, a lot of amazing, you guys, videos, go get it. So,
Dr. Alex Vasquez. Dr. Alex Vasquez, yeah. All right, well, hey, thanks, Doc. Thanks for sitting down with me today and giving me all this information. To everybody listening, thanks for tuning in. And if you've got any other questions that you want Dr. Serrano to hit on in the future, let me know. Thanks for watching.